If you're trying to get pregnant and it's just not happening yet, this video is for you. In this guide, we're going to go over exactly what to do next, step by step. I'm Dr. Loria Shaheen. I'm a double board certified OBGYN and reproductive endocrinologist, helping people build families for almost 20 years. And I love helping people with these first early steps to really help them have the baby of their dreams. I love educating. I'm so glad that you found this channel. Be sure and subscribe so you get my weekly video all about reproductive health. Take a look through the channel. You will find so many resources. I've got my podcast here, the Baby or Bust Fertility Podcast, with weekly interviews and in-depth discussions on all things reproductive health. If you want to learn about lifestyle optimization, exercise, sleep, nutrition, so much information in that playlist. I've got a playlist on IVF, on fertility tips, so much help here. I'm really glad you found it. But again, subscribe to the channel so you get my weekly videos. You don't want to miss it. If you are trying to have a baby and it's just not happening yet, it can be so confusing and so frustrating. I mean, this is not what they taught us in middle school health class. We were taught it was so easy to get pregnant that we had to fear getting pregnant before we were actually ready. So when you are ready and it's not happening, man, it can be frustrating. You could be asking friends for advice. You could be searching on the internet for advice. But I've got some tips here, some first essential steps that can help you right now. Step number one, we're going to go over planning for pregnancy. Step number two, we're going to review some habits that you should stop and start in order to help you conceive. Step number three, you've got to know your cycle. Step number four, we got to time trying to increase our odds. And step number five, we cannot make assumptions. Now stick around to the end of the video. After I go through these 5 important first steps, I'm going to give you 3 reasons that you should seek help now. Don't pass go. Go straight to the doctor. Now, before we get to these 5 essential steps, I want to make sure that your expectations are set correctly. Because again, in health class, we were sort of taught that it's so easy to get pregnant. It just happens 100% of the time. And that's absolutely not true. So what are the chances? Like, what are the odds? When should you say, oh, I'm falling outside of the norm? So when we are in peak fertility, when we're in our 20s, when we are trying with one cycle, so that's one egg, one sperm, one ovulation, it could be trying multiple times in that cycle, but it's one opportunity and one menstrual cycle. We have about a 25% chance of getting pregnant and having a baby. It's not even 50-50. It's certainly not 100%, about 25%. By the time we're in our mid-30s, everybody talks about 35 being this fertility cliff. It's not true. It's not like your eggs shrivel up on your 35th birthday, I promise. But at age 35, the chances of getting pregnant with one cycle is about 10%, maybe 15%. By the time we're 40, that chance is about 5%. Again, we're just talking about one cycle and one try, but that's one of the reasons why as we age, we should seek help sooner and honestly not be too surprised if it takes a little while to conceive. Now, what are your chances, after you try for a little bit? So about 50-60% of couples will conceive within the first 3 months of trying. So that's a lot of people, but it's not everyone. Now, 85% of people will conceive within a year of trying. So the definition of infertility in most textbooks and most online resources will say you have to be trying for a year in order to get the definition of infertility, because 85% of people will conceive within that first year of trying, where it's the 15% of people that have not conceived that should really start to think about getting testing and evaluation. There's lots of people that should go sooner than that, but that's what you'll hear most often. So now that we've got our expectations set, hopefully it helps you relax a little bit and you realize that not everybody gets pregnant every single time that they try. I mean, I know that you know that, but it's really nice to have some reassurance and some real numbers. So step number 1, planning for pregnancy. So even if you started trying, I think it's important to think about checking in with your doctor, your primary care doctor, your gynecologist, about a preconception visit, especially if you have chronic medical conditions like high blood pressure, heart disease, kidney disease. You want to really think about a health checkup and let your doctor know that you're planning to get pregnant. This is especially important if you are taking prescription medications. You want to review it with the doctor that is prescribing it. Hey, I know you prescribed this medication for me for a long time, but now I'm actually trying to get pregnant. Is this still okay to take? So, for example, high blood pressure, there's some blood pressure medications that are better to take when you're pregnant than others. Another part of planning to get pregnant is taking a prenatal vitamin. Taking a prenatal vitamin for about 3 months before you actually get pregnant can decrease the risk of multiple pregnancy complications. And taking a prenatal vitamin for about a month before you get pregnant decreases the chances you're going to have nausea and vomiting in pregnancy. Now, if there's motivation to take a prenatal vitamin, that is definitely one for me. See my video here all about prenatal vitamins, what to look for in a prenatal vitamin, and how to find the right one for you. Step number 2, let's examine some health habits. There's some habits that you should absolutely stop. There's some health habits you should modify, and there's some that you should really start to pay attention to because the healthier you are, the better your reproductive health is going to be. So first thing, stop smoking and vaping. Tobacco products, no matter how you ingest them, are not good for your fertility and not good for pregnancy. Now, studies vary on alcohol and marijuana. I do have videos here, extensive videos, and review the research on both of those for fertility and early pregnancy. We all know to stop drinking alcohol as soon as we are pregnant. There's something called fetal alcohol syndrome, and the baby can be born with birth defects if we are drinking alcohol, especially in early pregnancy, late pregnancy. And the hard part is nobody knows how much alcohol is too much, and every person is a little bit different. So when you're pregnant, absolutely stop. Before then, I think modify. Certainly should not be drinking every day, should not be drinking a large amount of alcohol in settings, but it can something that is social, enjoyable, and just modify. Marijuana, that too. Studies vary. It can definitely impact sperm function and numbers. It may impact egg quality and miscarriage risk. But again, studies vary. But there's nothing that proves that marijuana is safe. I think a lot of the processing and pesticides, we have to be very careful about marijuana, and you just cannot assume that it's safe. Should not be something that is every day, should not be in large quantities. It should be something that is definitely modified. Talk to your doctor about what's right for you. Next, limit caffeine. Studies do not show a decrease in fertility, time to pregnancy, or changes in IVF success rate. I know some studies vary. We've got a great video here. I do a deep dive into caffeine. But once you are pregnant, you should really limit it to less than 250 milligrams of caffeine a day because there are some studies that show a slightly increased risk of miscarriage with a high caffeine intake in early pregnancy. So modify, a little bit is okay, but just not excessive caffeine. Now let's talk about some positive health habits. So I talk a lot about nutrition, exercise, sleep, and stress management. I have a lot of information in my playlist here all about lifestyle optimization because I truly believe within reason that the healthier you are overall, the better your reproductive health is going to be. It just makes sense and the studies support it. So exercise, important for physical and mental health. You shouldn't stop exercising, but you might want to modify. It depends on your activity level, and you certainly don't want to start training for a marathon if you've never run one when you are early pregnant or like actively trying to conceive. People are going to argue back and forth about things, but I just think moving your body is important, but just not to extremes. Again, check out my videos on exercise and fertility, and especially exercise if you are undergoing IVF treatment, because there's some different recommendations. Stress management, so important. I don't want you to stress about stress, but high cortisol levels are not good for our overall health and well-being. And so learning techniques for stress management are extremely important. Sleep, optimize. Sleep is absolutely so important. Get into habits, make your bedroom a quiet, dark place. Prioritize sleep. It helps with all hormone balance, energy levels, circadian rhythms are important. So focus on sleep. Nutrition, everything in moderation. You don't have to eat everything absolutely perfectly. I'm on the 80% plan. So the majority of the time, non-processed, non-fast foods, Mediterranean diet has been associated with some positive outcomes for fertility and especially IVF treatments. Fresh fruits and vegetables, again, less processed foods, but enjoy your life. Every once in a while, ice cream tastes absolutely amazing. McDonald's French fries on the day of your embryo transfer, people talk about that all the time as a fun little treat. I don't want people to associate restriction and removing joy from their life as a way to sacrifice in order to be fertile and have a baby. And I feel like that those things kind of get intertwined. That's why I talk to my patients about being on the 80% plan. If 80% of the time you got great sleep, you're focused on your nutrition, you're moving your body, you're thinking about stress management tools, that is perfection. Step number 3, you have got to know your cycles. Start tracking now. You need to know if you are having a monthly cycle because that is a really good sign. Less than 25% of people actually have a predictable 28-day menstrual cycle. Most of the time, there's a little bit of variation. Sometimes people can have 27-day cycle and then a 31-day cycle and then a 29-day cycle. But if you're having predictable monthly menstrual cycles, it's a really good sign that you're having predictable monthly ovulation. And so just start keeping track of your cycles. Sometimes people like to use apps. There's nothing wrong with an old-fashioned calendar where you're just kind of circling days and just look for a pattern. And when you know what your pattern is, then you can look back and figure out the middle of your cycle. That's when you're ovulating, and that's an excellent time to try to conceive. So I've got great videos here on how to know that you're ovulating and kind of what's a normal and not normal period. I really want these videos to help, and you can kind of go into a deep dive to make sure that you're not missing anything. Now to step number 4, once you know your cycle, once you know that you're ovulating, then you can really know the best days to try to conceive. So I go into a deep dive into this on a great video where I'm like, these are your best days to try to get pregnant, and I explain it, but it all goes down to physiology. Listen, after intercourse, the sperm is in the reproductive tract looking for the egg for up to 5 days. After ovulation, the egg is viable and hopefully receptive to the egg for about 12 to 24 hours. So if you think about that, you don't want to wait until late in the cycle or make sure you're having signs of ovulation and then try to have intercourse, because there's a chance that you miss the signs of ovulation and you miss your opportunity that cycle. So you actually want to try a couple of times in the week leading up to and including ovulation. Everybody's going to have strong opinions on this. You do not have to have intercourse every day. You don't have to have it a certain time of day. 2 or 3 times in the fertile window, which these 6 days leading up to and including the day of ovulation, you are going to have the opportunity to get pregnant. And finally, step number 5, don't make assumptions. It's never too soon to get some basic tests done. If you could choose one fertility test, semen analysis. And I know you weren't thinking that one because we always think about anything that has to do with reproductive health, baby making, miscarriage, fertility. It's always the woman's fault. You know what? There's a male factor part of a fertility issue up to 50% of the time in couples that are struggling to conceive. And you cannot make assumptions. Just because someone has caused a pregnancy in the past, that does not mean that their current fertility is the same. Semen analysis is non-invasive. I know sometimes people get nervous about kind of the production of it, but it is so high value because you can often find an issue and you just don't want to miss that. You don't want to make assumptions. Semen analysis is very important. I've got some videos here that can help you prepare and kind of understand the results from a semen analysis. And you can even get some, kits sent to your home. They're not as detailed as a report from a fertility clinic like mine, but the at-home, semen tests are at least a place to start because they're at least going to tell you if there's like no sperm in the ejaculate or a really, really low count. So that is something that is sort of comfortable for a lot of people. It doesn't require having a doctor's appointment or having a doctor call in. That might be something that you consider as just an early kind of baseline, just not making assumptions. For testing for women, you can get a lot of at-home tests done too. I prefer if you get things through a doctor because it helps with that interpretation. But there's some at-home tests for things like AMH, anti-Müllerian hormone. It's not a perfect test, but if you get a red flag, if it's really, really high or really, really low, it's something that might help you seek counsel, information, an appointment with a specialist sooner. Just don't make assumptions. Get some early testing and look into some at-home testing. It's less intimidating. It's not as precise as what you can get with a doctor, but it can be a really non-intimidating and easy place to start. So, the 5 steps that we talked about, if you are trying to conceive and it's just not happening yet, are making sure you're ready to get pregnant. You've done some pre-pregnancy planning. You've examined some habits you should stop, some you should modify, and some you should really focus on. Number 3, you've got to know your cycle. Number 4, you got to know when to try in order to optimize. And number 5, we cannot make assumptions, and it's a really good idea to do some basic testing sooner rather than later so you don't miss anything. Now, I'm really glad that you stuck around to the end of the video because I want to go over 3 main reasons that you should not waste any more time and that you should get an evaluation now. So, number 1, irregular cycles. If you're not having predictable monthly menstrual cycles, you're not having predictable monthly ovulation, and it's going to absolutely, most likely, take you longer to conceive. You should figure out why. Is it a hormone issue? Is it an anatomy issue? If you are not having predictable, regular monthly menstrual cycles, figure out why. Now, again, you can have a little variation in days, like 26-day cycle, 28-day cycle. That's fine. Your cycle is going to be right for you. But if it is very erratic and unpredictable, you should really figure out why so you don't waste any time. Number 2, if you're age 35 or older and it's just not happening quickly, I would go straight to a fertility doctor. I really would. I just don't want you to miss anything. And I really want to have good counsel about your family building goals. It can take longer to conceive as the eggs and sperm age. And if you really want to have a big family, you're really thinking about your family goals, I just want you to know all of your options. And I want you to get testing sooner rather than later because I just don't want you to waste any time. If there's a significant sperm issue, if there's a significant anatomy issue, if you're not ovulating, just be a little bit faster to get professional help if you're age 35 or older, or you want to really think about your overall family goals. People are so hesitant to come see a fertility doctor because they assume something. People are worried that we're not going to find anything, and then people are worried that we are going to find something, or people are worried that we're going to push patients into treatments that they don't want to do. Nobody can force you to do anything that you don't want to do, but you can get good advice about your current fertility so that you can make plans to make sure that you have the family of your dreams. And finally, number 3, do not ignore symptoms, things to look for. If you have really painful periods, ask about endometriosis. If you have really irregular and erratic and unpredictable menstrual cycles, or it takes a long time to get a period, that could be a sign of PCOS or polycystic ovarian syndrome. If you have spotting in between your cycle, again, irregular bleeding, that could be an anatomic issue. It could be a fibroid, it could be a polyp. So if you're having symptoms, things that you're worried about, don't hesitate. See your doctor, ask questions, and make sure you get a plan that is right for you. I hope you learned something in this video today. I love sharing this education. Be sure and like this video if you learned something. Comment with questions that you have, topics you'd like me to cover. Be sure and subscribe to this channel so you get my weekly video all about reproductive health. Don't forget to listen to the podcast wherever you listen to podcasts, Baby or Bust Fertility Podcasts. And until next week, wishing you love, luck, and pineapples.